3 years ago, during my sophomore year of high school, I started experiencing crippling pain in the majority of my joints for seemingly no reason. It was hard for me to walk in the morning, it was hard for me to get dressed, and it was even hard for me to open doors by myself sometimes. So began a very long diagnosal process, and after several months, I was diagnosed with rheumatoid arthritis, a chronic autoimmune disease that has since affected just about every part of my life. So with that, my topic is arthritis. Arthritis is not a single disease, but rather a term used to describe joint pain as a whole, or a general term used to describe joint diseases in general. And I know what you're probably thinking, and that's that only really old people get arthritis, so why should you care? But according to the National Health Interview Survey conducted in 2011, 22% of adults have been formally diagnosed with arthritis. That's over 1 in 5 people in America, so that's affecting a lot of people. Additionally, it's also the #1 cause of disability in America, so this is affecting a lot of people in our daily lives, and the chances of you or someone that you love eventually having arthritis is pretty high. So today I'll be breaking arthritis into the 3 categories that the disease falls under, and also telling you about the 2 most common types of arthritis, osteoarthritis and rheumatoid arthritis. So there are over 100 types of arthritis, or over 100 types of diseases, but they all kind of fall into 3 categories. The first of these is wear and tear, which basically just means the natural, gradual wearing down of the joints over time. And the most common example of this is osteoarthritis. Osteoarthritis is also the most common type of arthritis. The second type is autoimmune diseases, so this basically means that someone's immune system is attacking the tissues and their joints and organs, causing that joint pain and the arthritis. And some examples of this are rheumatoid arthritis, lupus, and psoriatic arthritis, are just a couple. And the third type of arthritis is crystal development in the joints. So this basically means that there's some kind of crystal deposit forming inside of a person's joints, making it harder for them to move that joint and also causing pain in those joints. Some examples of this are gout, which is uric acid crystals building up in someone's joint, and also calcium crystals. So osteoarthritis, like I said, is the most common type of arthritis. Osteoarthritis is the most common type, and it's because of the gradual wearing down. As you can see in this visually, it's the literal wearing down of the joint, and it kind of pushes the bones closer together. When you hear someone say that they have arthritis in a specific joint, like I have arthritis in my hand, I have arthritis in my shoulder, they're probably talking about osteoarthritis, or OA for short. And according to an article titled Pathogenesis and Management of Pain in Osteoarthritis, radiography is the main method used to diagnose osteoarthritis, since, as you can see in this picture, the wearing down of the joint causes a really visible difference between a healthy knee and between a knee with osteoarthritis. And while it is caused by just the natural wearing down, there are some risk factors that could accelerate or could make you more susceptible to having OA, and some of these risk factors are age, genetics, and obesity, as well as overuse or injury. An article in Clinical Medical Insights even provides research that OA can be accelerated in athletes or if you had a joint injury. So if you're an athlete or just an active individual in general, you may be more susceptible to having OA in the future. And as far as treatment for osteoarthritis goes, especially in older people, a lot of the treatment just has to do with changing your lifestyle and changing how you're living and how you're using your joints, as well as simple topical agents like lotions and things like that. However, if it's accelerated, then you may be prescribed medication or even have to have surgery if it gets that bad. So now I'm going to be talking about rheumatoid arthritis and kind of the difference between those two. So like I said earlier, the main difference is that rheumatoid arthritis is an autoimmune disease. So this means in a person with RA is the abbreviation. In a person with RA, their immune system, for whatever reason, is attacking the healthy tissues in their joints and organs and causing inflammation and swelling and joint pain overall. And while there's no known reason for why someone's body starts doing this, there are some risk factors involved. According to an article from the Journal of Musculoskeletal Medicine, some of these risk factors are genetics, age, infection, and immune system abnormalities. Also, there's been a ton of research done lately on the role that stress plays in autoimmune diseases overall, and according to an editorial in Arthritis Research and Therapy, it conclusively states that the activation of stress systems increases the risk of having RA or aggravates the condition if it already exists. So stress can also play a role in RA. RA is also really hard to diagnose. As presented in an article from the American Journal of Medicine, there's no single test that determines whether a person has RA, and the most accurate test is only accurate 60% of the time. So because of this, doctors kind of have to use a variety of symptoms, such as morning stiffness, swelling of the joints, and several blood tests overall to be able to substantially say that someone has rheumatoid arthritis or not. And some of the symptoms are inflammation. So as you can see in this picture, rheumatoid arthritis is characterized a lot more by inflammation of the joints and swelling, whereas osteoarthritis is kind of the wearing down, although both of them do have the similar characteristic of the bones like wearing down inside of the joints and just pain overall. As far as treatment for rheumatoid arthritis goes, the most common form of treatment right now is anti-inflammatory prescription medication that aims at reducing the swelling and also reducing the pain of the joints. And there is no cure for rheumatoid arthritis or really any kind of arthritis at this point. So today you guys have learned about the 3 types of arthritis and also the 2 most common types, osteoarthritis and rheumatoid arthritis. But you still may be skeptical about why this applies to you, an 18 or 19-year-old. But in a study done by the American College of Rheumatology, it is projected that by 2030, 25% of adults will be formally diagnosed with arthritis, and this number is only going to increase over time. So this is going to be affecting a lot of people. 1 in 4 people is a lot of people. Additionally, as age expectancy increases, this is going, and people kind of start working as they're older, well into their 70s even. This is going to be affecting a lot more of the working class, and it's going to have cause a lot more people to have to not be as able in the working force. Also, for how many people this affects, I personally think that this disease has relatively little awareness for how many people it affects, and especially since it has no cure whatsoever. But the good news is there's tons of research being done all of the time. May is actually Arthritis Awareness Month, and which is promoted by the Arthritis Foundation, which donates millions of dollars to arthritis research every year. My sorority on campus, Alpha Omicron Pi, this is actually our philanthropy, and just in the past month we've been able to raise over $30,000 to donate to the Arthritis Foundation, which I think is pretty cool. So I hope you guys feel a little bit more aware about arthritis, since it's Arthritis Awareness Month, and hopefully you've been able to learn about this disease that affects millions in the world today.